Hello and welcome to the Imprint Weekly Podcast. I'm John Kelly, Senior Editor of The Imprint, a daily news site covering child welfare and youth justice around the country. You can read all of our coverage at imprintnews.org or check us out on Facebook or Twitter at The Imprint News. You can also sign up on our homepage for our free weekly and monthly newsletters. And for professionals in child welfare and youth justice, subscribe to our Youth Services Insider section for a closer look at news on business policy and practice. The Imprint Weekly Podcast is also a member of the Safe Camp Audio Network. Check out our show page and all of Safe Camp's other great podcasts at safecampaudio.org on the web or at Safe Camp Audio on all major social media. On this week's episode, we are joined by Rebecca Jones-Gaston, Commissioner of the Administration on Children, Youth, and Families, and the most senior Senate-confirmed child welfare official in the Biden administration. As we have talked about quite a bit on the podcast this summer, the administration has put out quite a few new child welfare policy rules and clarifications over the past year. So we talked to the commissioner about those, implementation of the Family First Prevention Services Act, about what the priorities will be for the last 4 months of the administration, and much more. So without further ado, here is our interview with Rebecca Jones-Gaston. All right, we are joined today by one of the most senior child welfare officials in the Biden administration, Commissioner of the Administration on Children, Youth, and Families. That is a mouthful. Rebecca Jones-Gaston. Commissioner Jones-Gaston has been on the job since getting confirmed in late 2022. Commissioner, thanks for joining us on the Imprint Weekly Podcast.
It's my pleasure. Thank you for having me.
I was looking back. Am I right that you got confirmed the day after Christmas?
It was actually the day before.
Oh, it was?
It was like the 22nd, 23rd, and then there was Christmas, and then I was in a new job.
What a present. What a present to get. So rules on our podcast before we get into the serious stuff. These guys got to get to know you a little bit. So I'm going to give you the categories. You got to give me at least one favorite in these categories. You can give me more if you want. No pressure. Okay. Don't worry.
All right.
Categories are TV, show or movie, sports team, musical group, or book. The commissioner is writing it down.
Wait, all of those are my options?
No, all of those. You only have to pick one. You could give me all 5 if you want.
Okay, so TV show, movie, sports team,
musical group, or a book.
Oh, I should probably be academic and say a book, but I will say, and for the benefit of my adult children who I make watch this movie every Christmas, Sleepless in Seattle is my absolute favorite movie. I have no explanation why. But The Saints, favorite sports team. And for music, it's not a group, but it's Prince. I'm a ride or die Prince fanatic.
I believe you're the third person in our 180 episode arc to pick Prince. Prince is probably one of the most chosen people.
Yeah. I was born in Minnesota. I was just about to ask why the Saints, because I knew you're a Minnesota gal. Well, I grew up in Iowa, and we have no professional teams whatsoever. Yeah. But I actually, when I went to college, the first person I met when I hit campus in DC was this person from New Orleans. And I got to spend a lot of time in New Orleans and just fell in love with the city. And so I love football. So I just adopted the Saints as my home team.
Those are solid answers all around. Thanks for going above and beyond and picking 3.
Absolutely.
So over the past year, the administration has finalized, 3 rules of potentially large consequence to the field on the approval and financial support of kinship caregivers, legal representation for parents and kids, appropriate placements for LGBTQ youth. What was the process for putting these rules together? How did you decide what to pursue and how you do it? And what has the reaction been to these as far as you can tell? Do you see folks, mobilizing pretty quickly to take advantage of these, and in what ways?
What we've been really doing in this administration is really making sure that we are talking to the folks that are experiencing the systems that we're running. And so the child welfare system impacts communities around the country. And so making sure that we're talking to young people, to parents, to get their input and perspective about what's working and what's not working. So as we're thinking about ways in which we can support improving the experience and outcome of children and families connected to child welfare, we've got real in-person perspective and input on things to be considering as we move forward. So my background, I'm a social worker at heart. I have an MSW, been a caseworker, done all the things on this journey. And we've been talking about kinship care for quite some time as a really solid and viable resource and option for helping kids stay connected to family, even if experiencing the child welfare system is something that happens. But one of the hurdles that has been experienced for quite some time is that oftentimes, grandma or auntie can't quite meet the standard licensing requirements that a traditional foster home is required to. And that can include number of bedrooms, the size of the bedrooms, your age, all those sort of things. And states and jurisdictions have been able to issue exceptions, but we thought it was really important to actually create a pathway for a separate licensing standard that just makes it the way it is for kin. And when I say kin, I mean relatives, but also the other term we sometimes use is fictive kin. So that could be your neighbor who serves as an auntie, or your godmother, or a really good family friend that a child has a connection to. And the big focus being, the experience of foster care, even in the best case scenario, is a traumatic experience because you're separated from your parents and your family. And so if we're able to create a way for children to be able to stay connected to the people that they care about and that care about them while they're going through this, we want to be able to do this. The other thing that I'll just add here is one of the key things in this rule is the expectation that kin caregivers are going to be supported in the same way as traditional non-relative caregivers are supported by the foster care system. And so that requires that any sort of resources and supports are a one-to-one match for relative caregivers.
In addition to the rules that we just talked about, there was also kind of the significant proposal around how states use temporary assistance for needy families. That would have made it, spending on foster care kind of mostly a no-go, although kin could have been still supported. I think that's still kind of in the proposal phase, but any word on that? How do we feel about that potentially getting finalized, in these last months here?
Yeah, so it's still in proposal phase, and I know there were lots and lots of comments that were received, and so working through that. But one of the things, while that is kind of working itself through the process that happens in developing rules, we're also working really closely, the Children's Bureau and the Office of Family Assistance, where TANF sits, working really closely together to make sure that agencies and communities understand how they can work together. Those two systems can work together in a way that is both an option for prevention so that children aren't experiencing foster care, but also how resources and supports can be available for kids and relative caregivers kind of across the spectrum of care.
We're talking about rules right now, and that's a fairly elaborate process that goes through review and comments like the commissioner's talking about. Towards the end of the summer, the administration made a lighter touch change, let's call it a clarification to the Child Welfare Policy Manual on a few things, many of which pertain to the Family First Prevention Services Act, which our listeners know we talk about quite a bit here. So I'll link folks to our basic explainer at the imprint about what all went into that. But can you talk just a little bit about some of these updates and what prompted you guys to take those actions?
Yeah, so we had the opportunity in partnership with the White House to have a convening on transforming child welfare, and that being a really important conversation that isn't just about the 4E agency or the child welfare agency. It is around the whole kind of collection of supports and services that are available to communities And so it was an opportunity to be able to highlight some examples of where some agencies and some communities have found some really creative ways to work together to support kids and families as a prevention mechanism of keeping kids out of foster care, but also in support of caregivers. And, one of the things that we wanted to do is to make sure that we are explicitly clear around definitions and the importance of those definitions, and wanting to make sure that poverty isn't conflated with neglect. And in many ways, the application of it in the data that we see is that a lot of the experience of poverty is translated into neglect across jurisdictions. And we think very strongly that just for that reason, children shouldn't necessarily have to be in foster care, right? So let's think about what our definitions say and how we disconnect that. I think the other area where we were able to make some light touches, as you say, but some real, I think, solid clarifications were around how child welfare agencies can actually use some of the funding that they already receive in some ways towards prevention and making that clear. And so one being in that family first space, and this gets a little kind of nerdy, fiscal, technical, and so
we
feel
love
free
that
to ask
here.
questions. All right. We've got admin costs, admin claims that can happen in the family first space. And we wanted to make it really clear that some of that admin cost can also include how to support a parent or a child actually being able to take advantage of a family first prevention intervention. So that might mean peer-to-peer navigation supports. That might mean transportation to actually get to the actual intervention. It might mean childcare so that the caregiver can participate in the intervention in really meaningful ways. And just wanting to explicitly kind of open up that thinking to jurisdictions to think about how they could tap in.
Were you hearing from states that was something that was holding them back, frankly, from kind of embracing it?
So the pleasure that I have had is having served in the state leadership role in two jurisdictions prior to taking this role. And so I have a pretty good sense of where some of the business operations pieces can get a little entangled with what you're trying to do in practice. And no offense to fiscal folks, they like very clear of what you can spend dollars on. And so this really was an opportunity to just be clear that these funds can actually be used towards these opportunities to help support families take advantage of the interventions of prevention.
I look back at our coverage of your confirmation hearing where the family first was very much on the minds of senators that day. I think you would agree. They wanted to know what was going to happen. And you said, one of the things that you were going to really focus on early on was to figure out what these states that really hadn't even submitted a plan yet needed to get up off the bench. So because I'm a dork, I look back and did the benchmarks. At the time, there were 20 states who had been approved, 19 had submitted a plan and hadn't heard yet, and 11 that hadn't submitted. Today, we have 42 approved, 5 in the submission process, 3 who have not submitted. I know you won't call them out, so I will. Alabama, Alaska, and Texas. What do you want to take credit for here? What did you guys do strategically as opposed to this is just, some of this was going to happen anyway, but what did you guys, do to get people kind of moving that weren't?
Yeah, well, we provided a lot of technical assistance and had a lot of conversations with the jurisdiction leadership in general around, what are the hesitations? What are the concerns? Lots of questions came up about, do we have the right interventions in the clearinghouse? And we worked really closely with the Office of Planning and Research Evaluation as they updated the handbook related to the clearinghouse to try and address some of the questions and hurdles related to practices getting in there. But one of the things in the announcement that we did during the White House convening was be able to highlight the fact that we are offering and extending tribes flexibilities in the prevention interventions that might be outside of the clearinghouse that are culturally and tribally specific in ways that didn't really exist before. And so some clarifications on how they can do that. And we're in the process of providing technical assistance there. I had the opportunity, I was going to say last month, but since we're in October now, it was 2 months to go down and celebrate with Puerto Rico and having their Family First prevention plan approved. And that was 2 years of work with Puerto Rico and our regional team and our, policy teams within the Children's Bureau, just going back and forth and answering lots of questions and working towards the solution. The bottom line is, I firmly believe that everyone wants the best for children and wants to figure out how to take full advantage of what Family First offers. And I think that focus and support with jurisdictions has been where the success has come in getting more and more jurisdictions to get plans submitted, and that we're now getting resubmissions with some amendments and those plans continuing to evolve and grow. And so we're not letting up as we move forward.
So state movement towards, admission and uptake is one big part of Family First. The other, obviously, one other big one, and it's certainly inextricably linked, is this process by which the clearinghouse that was established reviews potential candidates for inclusion. So we talked about your confirmation hearing. Fast forward to a more recent appearance by you before the Senate Finance Committee. Some of those guys seemed frustrated they hadn't heard from some folks at HHS about their concerns around the clearinghouse, which include it kind of being a little, I think they're hearing from stakeholders that it's academic, it's opaque, they're not being proactive, they're only waiting for things. So I guess the first question, they wanted you guys to respond. Have you responded? And what is your view of the clearinghouse process so far as an administration? Like, what would you like to accomplish? I'm going to ask you bigger picture about priorities for these next couple of months, but what would you like to accomplish before you leave on this thing?
So one of the things is we wanted to update the handbook in ways that we could do that didn't require statutory change. And so we did, and that was released in July. And we've gotten good response from folks there. There is very specific language in the statutory text that creates some constraint on kind of how far we get to stretch what the definitions mean. And so continuing to talk to congressional members and the folks that are really implementing the work on the ground and lifting up where they're kind of running into challenges, just to continue to raise that up as an issue. But I think one of the things that, is characteristic of mine is always trying to then find where are the spaces and places that we can push that obviously don't put us outside of what the law says, but might be a different perspective on how we can look at an interpretation or how we use plain language in explaining what the requirements are for a clearinghouse. And I said in the hearing in May, one of the challenges is that Congress now has, in the 2024 budget, cut a chunk of our budget for the clearinghouse specifically. And so, just continuing to advocate for what we think is needed from both the fiscal standpoint, doing what we can in trying to expand the capacity of the clearinghouse to meet the needs of the kids and families that we're serving, but also then working to educate and inform the lawmakers around where there are spaces and places that we need their help in this process as well.
Are you a professional in the field of child welfare, juvenile justice, or other family and youth services? Subscribe today to Youth Services Insider, the imprint's exclusive section on all the insider news you need to stay in the know. Funding opportunities, major federal and state policy shifts, interviews with key leaders in the field. It's all available only for our Youth Services Insider subscribers. Sign up for a monthly or yearly subscription today by visiting imprintnews.org/subscribe. Our podcast listeners get 10% off their subscription by entering the promo code podcast10. That's imprintnews.org/subscribe and get 10% off your subscription by entering the promo code podcast10 today.
whatever happens on election day in November, we will have a new president in January, which means this administration has about 4 months left. What are the top priorities for ACYF and the Biden administration when it comes to child welfare policy? What do you see as sort of must do before you leave here in 2025? Unless you stay, which I will leave for another day.
That'll be another conversation.
Yeah.
But, I think this past year has been a landmark year for the Biden-Harris administration, and certainly within ACF with our rulemaking. And so we are fully focused on supporting jurisdictions taking up the kinship rule, fully focused on supporting jurisdictions implementing the independent legal rep so that we can get kids and families and tribes and caregivers the representation that's so important when they are involved in the foster care process. And the implementation of the designated placement rule that creates protections for kids that identify as LGBTQIA2S+ in foster care, because every child should have the things that they need in the way that they need them in our intervention of foster care, right? So fully focused on providing the technical assistance and supports, answering questions, and helping jurisdictions take those opportunities kind of in full force at the local level. And I think the other place that we're really focused in on is in our partnerships across the federal government, continuing to look for ways where we can provide clarification and support about how we actually work together. And so the CMS just recently came out with new guidance or updated guidance on the EPSDT process and diagnostic process. We'll hopefully be soon coming out with some guidance that helps child welfare agencies understand how to take advantage of that guidance and apply it to meeting the needs of the communities that they're serving. We're, again, continuing to work really closely with our TANF office to make sure that we're able to kind of debunk some of the myths that people might have about what they can and can't use TANF dollars for, with the reminder that the first tenet in TANF in the statutory language is preventing children from being separated from their families. And so we're fully focused in on continuing to strengthen prevention and meeting the needs of kids and families together, and then supporting the jurisdictions and agencies that are doing that work at the local level.
Just before I ask my last two questions to the commissioner, I want to clear up two of the many child welfare acronyms she dropped there. CMS is CMS is the Medicaid office, just in charge of Medicaid and Medicare, and EPSDT. I'm not going to go through. It's a requirement that Medicaid providers do early screening and treatment on kids. It's very important, in particular for kids who are in foster care who are all eligible for that, and more states should be using it. That's editorialized. Okay. Home stretch here. Just want to ask you about the moment in child welfare and then a little bit about lived experience. But the first one, the federal data on child welfare, I think, has been pretty compelling of late. We've got these entries into foster care that have declined substantially and have continued to do so, I think, for 6 years now, which is quite a sustained, span of time. We have a record low number of substantiated cases of abuse and neglect per federal data. We also have seen 5 years of sustained increase in the number of recorded child fatalities attributed to maltreatment. And I'm not correlating these. I'm just kind of describing what the data portrays here. But what do these numbers and any other kind of metrics that you've seen say to you about, either the child welfare system performance or just families and safety in general? I think you're a good person to get perspective as a national leader, somebody who's run a state, somebody who's had experience here.
We've been talking about reducing the number of kids in foster care for quite some time. And so the fact that we've been able to do it in many local areas, but nationally have a steady decline in that, to me says people are getting it and understanding that foster care can't be our first line of intervention for kids and families. And then to me, that's very much connected to then, on the other end of the spectrum, the older youth that are exiting foster care. We've had a decline in the number of kids that then are exiting, but it's still an issue that we've got to tackle. Because children absolutely need to have connections and supports and the things that they need and not be exiting into other adverse experiences and challenges. And so we still have work to do there. But as we decline the number of children that are experiencing foster care, that kind of in turn is shrinking that issue as well. I think the other around substantiated child abuse is, again, to this point of getting better at what are we defining as abuse and neglect, and separating that from the experience of poverty and other adverse experiences, and making sure that we're working with systems that have the resources and supports to meet those needs. I oftentimes use the analogy of the child welfare being the emergency room. And, in the health world, we learned a long time ago that the emergency room isn't the best place to meet long-term health and well-being needs of individuals. And we in child welfare, social workers included here, have kind of said, historically, send all kids to us. We know all things. We can protect kids. And what we know from the data and from having those young people and parents talking to us about their experiences is that actually that system doesn't have all the parts and pieces that are needed to meet the diverse needs that kids and families have. And so we should actually get really good at what we're supposed to be doing. And that is responding to abuse and neglect when there needs to be an intervention, and helping then families and children get access to the things that they need outside of a foster care system whenever possible. And it might be in the partnership with other systems.
I'll get you out of here on this one. You recently reflected in a message out to the field about one of your favorite parts of the job being just sort of engaging with young people and families, and how important lived experience, is to what you do. Just going to quickly quote from you, and then I'll ask, but in your message, you said ACYF and our programs within the Children's Bureau and Family and Youth Services Bureau are committed to partnering with those with lived experience and integrating their voices into our work and policy. My question on this is, what have you found to be the most effective ways of incorporating lived experience into federal policy? What do you find works best as a process for doing that? I think it's an important question as more states and jurisdictions seek to do that in a way that feels right. I think we're past the ickiest sort of tokenism that might have happened in that space at some point, but how do you do it well?
No, and I really appreciate that question. And I think there are many things that we're still learning and working through. And I think the first thing that I would say is having people who have had lived experience on your teams. I think, my own experience as a child, but also then as a practitioner, brings a different lens than if I've just been in a policy office writing policy, right? And finding ways that we are engaging with folks kind of across the spectrum of experience, both kind of historical or old, as my kids would say, my experience is, and the more recent experience of what's happening now as a temperature check. And that can be listening sessions, and we've certainly done a lot of those. I meet with a number of young people and parent advisory groups on a pretty regular basis, and they come prepared with a list of things for me to be thinking about. Opportunities to weigh in on the things that get proposed. So those proposed rules that come out, making sure that folks are getting access to that and have mechanisms to actually offer their input when we're asking for public comment. I think the other is through many of the things that we've been doing, and I think the Children's Bureau is probably one of the agencies that's been doing this the longest time, through our contracts and our grants and those sort of things, setting an expectation that folks are going to have parents and young people and those that have experienced our system as part of the work that they're doing as an extension of what we're doing here in DC, and just making sure that that feedback loop is really open. And you called out tokenism, and because we want to avoid that at all costs, because that does more damage. I get a chance to each year have the group that goes through the foster youth internship program at the Congressional Coalition on Adoption Institute come and present their policy ideas. And those are things that we take note of. The perspective and the ideas and the creativity are absolutely going to come from those who understand where the hangups have been, but also understand where things have worked in some ways that, even myself, that I consider myself a seasoned practitioner, I certainly haven't been a kid for a while. Right. And so a young person's perspective is absolutely critical for the lens in which we're then putting pen to paper to create policies and things that are going to actually impact their counterparts or the young people that come behind
It's
them.
definitely one of the best resources anybody could read every year. I think if you look back 5 years before now, you'd see some of the things that we're talking about today and the recommendations. All right, Rebecca Jones-Gaston, Commissioner of the Administration on Children, Youth, and Families, thank you for joining us on the Imprint Weekly Podcast.
My pleasure. Thank you for having me. Thanks, John.
Thanks to Rebecca Jones-Gaston, Commissioner of the Administration on Children, Youth, and Families, for joining us today. The Imprint Weekly Podcast is a production of the Safe Camp Audio Network, which is a division of Fostering Media Connections. Please visit safecampaudio.org on the web or at safecampaudio on all major social media. This podcast is produced and mixed by Christine Anjoko, with music by Luke Giroux and Cyrus Elia. If you enjoyed this episode, we would love it if you'd consider subscribing or giving us a 5-star rating on Apple, Spotify, or wherever you download your podcasts. And we would greatly appreciate if you would support our work here on the podcast and in print. Small donations from our listeners and readers go a long way towards helping us grow and cover more great stories in child welfare and youth justice. To support us, it is super easy. Just visit imprintnews.org/donate. You can follow The Imprint on Twitter and Facebook by searching the handle at The Imprint News and visit us on the web at imprintnews.org. You can get us over email at tips@imprintnews.org. I'm John Kelly, and we'll see you next week.